Hello, my name is Gitte Lamunyon. I am an RN with XYZ Home Health Agency. Today I would like to talk to you about home care ethics. First, I would like to remind you about the status of our profession as reported by the Gallup poll. For the past 22 years, nursing has been reported as the most trusted profession. Next, I would like to review with you the ethics of our nursing profession as developed by the American Nursing Association. Whether you're a member of the association or not, nurses are held to these ethical standards. Provision 1. The nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Provision 2. The nurse's primary commitment is to the patient, whether as an individual, family, group, community, or population. Provision 3. The nurse promotes, advocates for, and protects the rights, health, and safety of our patients. Provision 4. The nurse has authority, accountability, and responsibility for the nursing practice, makes decisions, and takes action consistent with the obligation to promote health and to provide optimum care. Provision 5. The nurse owes the same duties to self as to the others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. Provision 6. The nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and the conditions of employment that are conducive to safe, quality health care. Provision 7. The nurse in all roles and settings advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. Provision 8. The nurse collaborates with other health professionals and the public to protect the human rights, promote health advocacy, and reduce health disparities. Provision 9. The profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and healthcare policy. As a student at Capella University RN to BSN program, I found additional ethical standards for home health industry from the National Association of Home Care and Hospice. The National Association of Home Care and Hospice, NAHC, was founded with the intention of encouraging the development and the delivery of the highest quality of medical, social, and supportive services to the aged, infirm, and the disabled. This code of ethics, adopted by the NAHC Board of Directors in September of 1982, serves as a statement to the general public and that the association and its individual members stand for integrity and the highest ethical standards. This code of ethics serves to inform members and the general public as to what are acceptable guidelines for ethical conduct for home care agencies and their employees. It is inherent in the declaration of this code of ethics that the association and its members pledge to protect and preserve the basic rights of their patients and to deal with them in an honest and ethical manner. The Code of Ethics serves as notice to governmental officials that the association expects its members to abide by all the applicable laws and regulations. The Code of Ethics is intended to serve as a guideline to agencies in the areas of public rights, responsibilities, relations to other provider organizations and agencies, responsibilities to the National Association for Home Care and Hospice, fiscal responsibilities, marketing and public relations, personnel, legislative, and when necessary, a hearing process. These are the apparent rights and responsibilities. The patient is fully informed of all of his rights and responsibilities. The patient has the right to have appropriate and professional care related to physician orders. The patient has the right of choice in care providers. The patient has the right to receive information necessary to give informed consent prior to the start of any procedure or treatment. The patient has the right to refuse treatment within the confines of the law and to be informed of the consequences of his or her actions. The patient has the right to privacy. The patient has the right to receive timely response to his or her request for service from the agency. As patients will be admitted for service only if the agency has the ability to provide and safe professional care at the level of the intensity of needed. The patient has a right to reasonable continuity of care. The patient has the right to be informed within reasonable time of anticipated termination of service or plans for transfer to another agency. The patient has the right to voice grievances and suggest changes in service or staff without fear, restraint, or recrimination. A fair hearing shall be available to any individual to whom service has been denied, reduced, or terminated, or whom is otherwise aggrieved by agency action. The fair hearing procedure shall be set forth by each agency as appropriate to the unique patient situation, i.e., funding source, level of care, diagnosis. The patient has the right to be fully informed of agency policies and charges for services, including eligibility for third-party reimbursements. A patient denied service solely on his or her inability to pay shall have the right of referral. The patient and the public have the right to honest, accurate, forthright information regarding the home care industry in general and his or her chosen agency in particular, e.g. cost, visit, employee qualifications. The amount of service billed to consistent with amount and type of service provided. The cost per visit includes only legitimate expenses. The medical equipment sold or rented to the patient is provided at the lowest possible cost, consistent with quality, quantity, and timeliness. The salaries and benefits of the provider and administration staff shall be consistent with the size of the agency, responsibility, and geographic location. The provider shall not engage in any kickbacks or payoffs. In much the same way that all nurses are held to the Code of Ethics of the American Nurses Association, all home health care and hospice workers may be held to the standards of the National Association for Home Care and Hospice. References for this presentation are from the Johns Hopkins Nursing Magazine, the American Nursing Association, and the National Association of Home Care and Hospice. A copy of this PowerPoint is available upon request. My contact email is Gitte, Gitte, Lamunyon, Lamunyon, @gmail.com. Thank you.